While our guests for this last panel are seated, I'd like to introduce them both to you. I've had the privilege and the pleasure to work with each of them through most of my own government affairs career. And these individuals in combination have likely had their hand on most, if not all, health policy and reimbursement legislation that's been enacted for the past 3 decades. They have spent their years in public service, providing guidance to presidents, members of Congress, and cabinet officials, and so we're very lucky to have them with us today. I'm going to first introduce Dan Smith and Don Moran together, then Dan will make some opening remarks. Don will follow with his opening remarks, and then we'll entertain questions from the audience. Dan Smith currently serves as staff director of the U.S. Senate Committee on Health, Education, Labor, and Pension, something that we in Washington, D.C. fondly call the HELP Committee. The Senate Health Committee is chaired by Senator Tom Harkin and has authorizing jurisdiction over the issues that touch the daily lives of all Americans in the areas of education, health, workforce, pension, and security. Dan's public service accomplishments include 10 years in the U.S. Senate from 1989 to 1999, where he held several senior staff positions in the office of Senator Harkin, including 4 years of Chief of Staff and more than 2 years as the Minority Staff Director for the U.S. Senate Committee on Agriculture, Nutrition, and Forestry. During Dan's tenure as Chief of Staff for Senator Harkin, he was intimately involved in the Senator's leadership to double the budget for the NIH and focus the attention of the Senate on the issue of prevention, particularly cancer prevention. These have provided us with the framework that has led to the molecular and genomic revolution we are now seeing emerge in cancer innovation. Many of you also may know Dan from his time as president of the American Cancer Society Cancer Action Network, the nonprofit, nonpartisan advocacy affiliate of the American Cancer Society, when he also participated in our Sea Change organization. At ACS CAN, Dan led and developed legislative, political, and grassroots strategies at the local, state, and federal levels to advance the American Cancer Society's life-saving mission and priorities. During his tenure at ACS, Dan helped launch the ACS CAN, giving cancer advocates an avenue to work for laws and policies that provide equitable access to cancer screening, fund crucial cancer research, and expand insurance coverage. He partnered with other organizations to help make 28 states and the District of Columbia smoke-free. And he founded One Voice Against Cancer, a coalition of more than 40 organizations. Since 2000, OVAC has successfully advocated for billions of dollars of funding for cancer research and programs at the National Institutes of Health, the National Cancer Institute, the Centers for Disease Control and Prevention, and the NIH's National Center on Minority Health and Disparities. Don Moran joins us as a representative of the other side of the aisle. You've often heard in Washington, D.C., that it's business and the folks in this town get things done through friendship. And nothing was truer on Tuesday evening when Sea Change called and said, we had a cancellation on the panel. Do you know of anyone that might be able to come and join the panel on Friday morning? So despite the fact that Don's company is working day and night actually with their clients whose interests and perhaps many of their futures relate to the work that the Joint Select Committee on Deficit Reduction is doing, his response to my phone call at 9:30 was, well, my dear, it seems you have a problem. Let me see if I can be part of the solution. Don founded the Moran Company in 1998 after a distinguished 24-year career in public service dedicated to the development and the implementation of health and human services policies as a government appointee. After launching his public service career in the state in Michigan in various roles, Don moved to Washington, D.C. in 1977 to serve as a legislative assistant to Congressman Dave Stockman. His responsibilities included staffing Mr. Stockman as a member of the Health and Environment Subcommittee on Interstate and Foreign Commerce and serving as staff director of the House Republican Economic Policy Task Force, which David Stockman chaired. Don moved to the U.S. Office of Management and Budget in 1981, and his public service career culminated when he was appointed the Executive Associate Director for Budget and Legislation, serving in that position from 1982 to 1985. In that role, Don was responsible for managing the government-wide budget review operations, as well as OMB's extensive involvement and interactions with the United States Congress on budget and appropriations matters. After leaving OMB, Don joined the private sector, working with ICF, which became the Lewin Group. And after a successful tenure as partner in those organizations, Don opened his own company, the Moran Company. The Moran Company has moved beyond the Lewin Group's historical base in policy research and consulting, and Don's company now oversees initiatives that assist clients in the formation of new business ventures in the healthcare field, research and consulting projects that require in-depth knowledge on both sides of the boundary between the public and private sectors of healthcare, and working with clients to develop effective policy engineering strategies. Don's political bona fides have been maintained throughout his private sector career as he has served as the health policy surrogate for Sea Change's beloved George H. Bush in his 1992 presidential campaign, and has also served as the senior health policy advisor for George W. Bush's presidential campaign in 1999-2000 and the Rudy Giuliani campaign for president. So without further ado, Dan, why don't you take the podium and make your opening remarks?
Good morning. It's so nice to be back with so many friends, and I see a lot of familiar faces out there, so I'm delighted to be here. I want to say, first of all, that my hat is off to all of you who do this work every day on behalf of people with cancer and their families. It's a admirable work that you do, and I just want to salute you for what you do and your dedication to the cause. I also want to say one other thing. If there's any press in the room, I have to do this or my press secretary will kill me. My remarks are off the record, so if there is any press in the room, they can see me afterwards and we can talk, but not in here. I want to talk a little bit about what Congress has done recently with regard to cancer and what we're planning to do in the future. I'll try to keep it brief, but there's a bunch of stuff to talk about. And while it's understating matters right now that Congress is not terribly productive, actually, when you look at the last Congress with regard to cancer, I think it's probably going to be seen as one of the most significant Congresses in our history with regard to cancer legislation. The first thing to remember about that Congress was in February of 2009 when the state children's health insurance program was reauthorized. That Congress passed, in order to finance that, a 61-cent increase in the federal tobacco tax. That is not an insignificant thing. Matt's sitting over there, you all know, for every 10% increase in the price, there's a 4% decline in usage among adults and a nearly 7% among children. So that act alone is having impact every day in this country, and I just think the importance of public policy, sometimes we forget these things and we focus on kind of the problems, but we also should focus on some of the progress that's actually being made. That's a significant thing, and when you couple that with what's gone on in the states, a significant work has been done around that issue. That was followed by another landmark achievement, the Family Smoking Prevention and Tobacco Control Act of 2009, which President Obama signed into law in June of that year. And that was something that the community worked collectively for more than 10 years, and a lot of people were involved in that. And it's having an impact every day in this country. If you've seen the new labeling that's come out, if you've seen all of the things that the FDA is now doing, the authority we have given the Food and Drug Administration to do this important work is really significant. And again, my hat's off to everyone who worked on that. And it's important to remember that that's in law and making a difference. That achievement probably would have been considered the most significant health achievement of that Congress had we not passed the Patient Protection and Affordable Care Act. And that clearly has dwarfed both any sense of any accomplishment that came before, but also the entire conversation of the last, especially that Congress, that was dwarfed by that. And no matter what you think, and I know people have very strong feelings about that law on both sides of the aisle, I've always said, and I said when I was working at the American Cancer Society, you have to take off your partisan hat and put on your cancer hat for a minute and look at this law from an objective perspective. This law is making and will make a significant difference for people with cancer. Celinda talked a lot about the coverage provisions in this law, but it is not insignificant that people who face a cancer diagnosis often lose their coverage, or they're prevented from getting coverage because of a pre-existing condition, or they ran up against their lifetime or their annual limit on those policies. Those things are all now no longer allowable under the law, and that is a very significant change. It bans the rescission of coverage. So oftentimes what would happen is a person with cancer or another chronic disease would get diagnosed, and the insurance company would find a small technical choice or technical error in the policy, and that policy, as you know, would be removed. And we saw these stories day after day in the Cancer Society, and I know many of you have experienced them as well. It also provides first dollar coverage for prevention, and that's really important, and Celinda was talking about the importance of prevention. And I think that it's something that actually people get intuitively. The old, an ounce of prevention's worth a pound of cure. People understand that in their gut, and yet we weren't practicing that necessarily in the payment system we were using. And so that's a very, very big change as we move forward. The getting rid of pre-existing condition is also enormous, and allowing everyone to actually get the same kind of coverage starting in 2014 will be an enormous change as we move forward. And finally, the coverage expansion itself is really, really important. In 2014, coverage will be extended to all Americans, expanding our Medicaid eligibility to 133% of the poverty line, as well as establishing the new insurance exchanges, and work is ongoing through the Department of Health and Human Services, partnering with the states to set up these insurance exchanges and make that happen. So that's an enormous piece of legislation and a lot of change that is happening as we speak. A second part of the law, which got very little notice, but it was something of great importance to my boss, something he sponsored, Chairman Harkin, was the prevention fund in the law. And that actually provides a sustainable push for wellness in this country. He very strongly feels, and many of you strongly feel, that we need to move from a sick care society to a health care society, our health care system, and this is a way to get there. It's one element of a way to get there. Right now, for every dollar we spend on health care, 75 cents is spent to treat the patient, but only 4 cents is spent on prevention of disease, and that needs to change. And this fund is actually going to provide $15 billion. It's actually already providing $15 billion over 10 years for wellness and other preventive services. This is funding things like tobacco quit lines. It's funding HIV screenings. It's funding public health workforce development. It's going to fund a diabetes prevention program that's going to be scaled up in the next year. Not obviously cancer related, but diabetes being an important disease that we need to get our arms around if we're really going to control costs in the future. So this is an enormously important thing. It is under attack right now in the Congress. Many people are trying to eliminate the funding. We're actually holding a hearing next week, and we're having the heads, John is sitting back there, Dr. Sefrin, and the heads of the Diabetes and the Heart Association are going to come testify in front of the committee to talk about the opportunity, the gap between what we know and what we're doing, and to talk about the fact that we need to do more as a country around prevention. The other thing I saw that Celinda mentioned was the issue around cost control, and again, enormously important. There is a lot of cost control in the Affordable Care Act. Again, people can argue about whether it went far enough or didn't go far enough, but there are some important things around pay for performance, around reducing preventable readmissions, around reducing healthcare acquired infections, and also experimenting with new models of care, like she talked about the Accountable Care Organization, which obviously needs a new name, but things like that to look at how do we actually pay for the value of care and not the volume of care. And I think that's going to be enormously important as we move forward. And the other thing in the a couple other things in the Affordable Care Act that I think are important are the provisions around eliminating waste, fraud, and abuse, and actually cracking down on that. We do have that in the system, and we need to be more aggressive, and the law actually provides a lot around that as well. And I know something else that this group is very interested in is health disparities. And we know, you all know these numbers about the disproportionate effect on low-income people, and we need to get after this. And a couple of things that the healthcare law does is it makes significant investments in data collection with respect to disparities. It also provides, above and beyond the NCI Center to Reduce Cancer Health Disparities, is at every part of HHS, the 6 HHS agencies, they all now have to establish a center for minority health within each of those centers. So that's another important thing. And the most important thing I think we can do in disparities is to not forget that we're actually going to provide coverage. That alone can do more to eliminate disparities simply by people being covered with health care. Last but not least, in the area that the Affordable Care Act that I know you're interested in is on the workforce. There are significant new investments made by the Affordable Care Act in workforce. Perhaps most relevant is the establishment of a National Healthcare Workforce Commission in health reform, and it's an independent body charged with examining and providing recommendations to Congress on how federal workforce programs can be improved and how federal dollars can be more effectively spent. And my boss, Senator Harkin, who is in the unique position of both chairing the authorizing committee, the Health, Education, Labor, and Pensions Committee, of which I'm the staff director, but also he's the chairman of the Appropriations Committee for Labor, Health, Human Services, Education, and related agencies. He's the first person to hold both of those positions since the 1960s, and so he has an enormous investment on both sides of the aisle about that. So the last thing I'll say about the Affordable Care Act is it is a breathtakingly big law. And again, whether you agree with it or don't agree with it, it is having an effect already. It will continue to have effect down the road. Clearly, we're watching what's happening in the Supreme Court, but this is a significant piece of legislation, and it didn't come about without a lot of hard work by a lot of people. The last couple things I'll turn to are FDA issues. I know this group is interested in FDA. One of the most significant areas of responsibility that the HELP Committee has is jurisdiction over the Food and Drug Administration, and we are in the process right now of reauthorizing the user fee acts. I know that that is of great concern to people who are doing research in this area. The user fee acts, about 60% of the budget for the office at the FDA comes from user fees on the prescription drug side. And we also are looking at a couple of other things in this new User Fee Act that has to be reauthorized actually a year from now. At the end of next September, we have to get this done. One is around generic drugs and another on biosimilars. And so we are spending a good amount of our time in the coming year to get this law reauthorized. Historically, these pieces of legislation have also attracted some additional FDA-related policy. Chairman Harkin is particularly interested in working with Ranking Member Enzi, and we've got a very good bipartisan process going, and other members of the committee, but he's looking specifically at a couple of issues. One that he really wants to focus on is the securing the pharmaceutical supply chain as one of his really top priorities, and the safety of the pharmaceutical supply chain. This piece of legislation will take an enormous amount of time over the next year for the committee, in addition to all the other things we're working on. But this is a very important priority, and we are committed to getting this done in the fastest time possible. The other thing I'll mention is I know the issue of drug shortages is a big issue. There have been frequent drug shortages, and many of them are related to cancer drugs. Senator Harkin, along with Senators Casey and Blumenthal, sent a letter requesting the General Accounting Office to do a study to look into the causes. We're awaiting that study coming back, but we're also, we formed a work group, a working group it's a bipartisan group with Senators Casey, Blumenthal, Klobuchar, Enzi, Corker, McCain, and Burr to look at these issues, and we are, the group is meeting frequently and looking for recommendations back from that. So that's a very, very important thing, and it's an issue that I think you'll hear more about as we move forward. Last but certainly not least, I have to say a couple things about funding, not in my jurisdiction, happily. My colleague on the Appropriations Committee has to do this. But the funding issues are clearly critical as we move forward and we've moved through this Congress. And Senator Harkin cares deeply about cancer research. He has been a champion for cancer research and for the CDC and for other programs for many, many years. He will continue to be that champion, but he also has the responsibility to put a budget together. And so he's worked hard to try to bring balance to that. I think he believes strongly that we actually need to get our fiscal house in order, but having a one-sided conversation about just cutting the domestic discretionary spending is not the way to solve this problem. It's not a big enough piece of the spending pie. It's also not, it's actually, he likes to talk about eating our seed corn. We're from Iowa. So it's not a good idea, and so we need to actually get that under control. And you know, we need to continue to work to fund the things that need to be funded, and we'll watch this process move forward. We are in a very messy time in Congress. And I like to usually end these talks by saying it's an exciting time to work in Congress, but exciting is not really the right word right now. It's maybe painful or maddening or frustrating, but nevertheless, I always remain optimistic. And I remain optimistic that even in this environment, we can make progress. I'll just give you a couple examples. I came this morning from, we're working very closely with Senator Enzi, who's our Republican counterpart, to reauthorize the Elementary and Secondary Education Act, No Child Left Behind. We're going to mark that up in a week from now, a week from Tuesday. That shows me we can make progress. We're working with him on the reauthorization of the User Fee Acts. There are ways to do this, but we have to break down some of the partisan barriers in the town and continue to work in a bipartisan fashion, and we will do that. And I appreciate all the work you're doing, so thank you very much.
Morning, everyone. It's a pleasure to be here with you. As Marguerite suggested 72 hours ago, I didn't know I was going to have the pleasure of being here with you, and so I appreciate the opportunity to do so. I guess I will say that it's also great to get over here because otherwise I'm sitting back in my office listening to the telephone ring with 150 clients who have a bad case of what you might call deficit attention disorder at this point in time. And so there's an awful lot going on, and I know Dan gets the brunt of that, as do all other members who are trying to figure out how to get to the super committee window. So it's a pleasure to be over here and have a few minutes to relax and talk about things. As Marguerite suggested, it's been many years since I've been an active office holder in either the government or the party, and so I won't appear to you ex officio of anything this morning. Rather, I thought my assignment was to draw on my undergraduate minor in cultural anthropology and attempt to take you a little bit into what I understand about the Republican health policy establishment and how my side of the world tends to think about where we are and where we're going and how that's likely to inform some of the choices that are going to get made over the next 2 or 3 or 4 years as we have to sort through whatever happens downstream of the Affordable Care Act. I think it's important to say at the outset that there is no observable consensus among Republican health policy leaders that would lead you to say that there is this thing called Republican health care policy. Even if there were, I think the vast majority of Republicans are somewhat less interested in that than their Democratic counterparts, just as a general proposition. And so it's, I don't want to pretend to you that what I'm going to be describing is a body of positions or a set of things that everybody agrees with one exception. That exception being is, I think, it's totally unifying within the Republican Party to believe that the way in which the Affordable Care Act was put together and done was a very bad idea. And some of that flows strictly from procedural grounds. As Dan suggested, this is a very huge piece of legislation, 2,700 pages worth, with not one single conservative idea contained therein. That you could think might just cause Republicans, just as a matter of a fit of pique, to feel unhappy about the thing. But as a practical matter, what it means is that there's a very large segment of thought among people out there in the world about how the healthcare system is supposed to look and work that we're effectively disenfranchised by the process of putting that piece of legislation together. And it'll be very interesting to see, and I think some of the things Celinda showed us in the last section about the antipathy of people to the substance of things and how it's been transformed into a political football really was because of the fact. Now, understand, as a former legislative engineer, I understand that the Democrats did the only thing they could possibly do to get the thing done. And so from that standpoint, it certainly is a great legislative triumph. But I guess from the Republican viewpoint, that kind of speaks for itself. And it basically makes the thing more of a political monument than it is anything else. From the concerns about procedural stuff, I think a couple of things flow. One is large chunks of this act were put together in ways that had no opportunity for refinement by either competition from other ideas or even controversy within the Democratic Party about what things are supposed to be. This was always very, 18 seconds before the markup, toss out the new chairman's mark, ram it through, get on to the next position. It was really hard to make the normal legislative process work in that kind of environment. Also, I think obviously we had a situation where you had a 2,700-page piece of legislation get enacted into law without going through a conference committee. That's, in my experience, usually a very bad idea from the standpoint of refining things into a workable level. Because if you really look at it, in the typical world of a piece of major healthcare legislation, probably 2/3 of what winds up in either the House or Senate bills gets either threshed together or winds up on the threshing floor in the standard conference, because a lot of things that sound great to people who need them to attract votes turn out not to work all that well in the light of day. And so from that standpoint, I think you're going to have to understand that the Republican leadership is always going to be in the position of being, at least explicitly on the record against the ACA, not solely because of what's in it, but because how it was put together. As was suggested, there is some concern about what the Supreme Court is going to do to this piece of legislation ultimately. There are really three choices. One is let it stand as it stays. Second is to take down the individual mandate and leave the rest of it intact. And the third is to take down the whole thing. I'm not sure that we at this point can handicap which of those three options is likely, or to put a probability on those three different possible outcomes. But I think it's fair to say that under anything but the first outcome, there's going to be a very substantial legislative work over the next 2 or 3 years to sort out what this legislation means if in fact the Supreme Court holds that the individual mandate is unconstitutional with or without the rest of it, because the structure you're left with is not a very appetizing structure in terms of something that's actually going to work in the real world if that in fact takes place. And so I think it's important at that point to understand the thinking of the kind of Republican policy establishment in healthcare, because they're going to have a very substantial opportunity to influence what's going there, because the political miracle that created the Affordable Care Act will not appear again, or is so very unlikely to appear again given the current electoral landscape. And so I think we're in an environment where what will survive out of whatever transpires there is going to need active Republican cooperation. So I thought you might find it helpful in understanding a few things about how these folks think. One thing I think you'll find that informs the thinking of most Republican health policy leaders is that it's important to make a distinction between installment financing of health care and real insurance. And by that I mean that a lot of things that go into a health insurance policy, ranging from prevention to routine health care services, are designed to get people to basically pre-fund their consumption of a variety of different stuff. Separate and apart from that are the onset of very serious diseases, which are often random, perhaps sometimes genetic, but certainly not planned or anticipated by the individual who occurs them, that all of a sudden put people in a position where their financial resources are under substantial stress. And I think what you'd find is that Republican leaders in thinking about these ideas will distinguish between those two roles of health insurance, and if economies have to be achieved, would heavily focus their economies on the front end of that rather than on the back end of that. I think all Republican health policy leaders recognize that there are certain relatively rare, very high-cost episodes that are really the reason why the American people value health insurance, and that any health insurance reforms that ultimately wind up either as the exchanges are implemented or as the exchanges are not implemented in favor of something else has to make that distinction. And I think you will find strong support in the Republican leadership for that kind of thinking, and making sure that the emphasis is on putting things together in ways that make sure that people with cancer and other dread diseases are in a position where they have substantial and effective coverage. In that regard, I think to offer some specific insight, many Republican leaders I talk to have very grave concerns about fourth-tier benefit designs in pharmaceutical benefits. While everybody understands the motives of the benefits managers in attempting to push back against the continued eruption of new technology into healthcare, I think everybody also understands that this stuff is sort of exactly what insurance is supposed to be about. That when we have people who have very rare and very high cost events, we want our insurance coverage to be concentrated on that. And so I think you'd see that thinking extending to a lot of different areas, and all by way of saying is I don't think that the thinking within the framework of my party is going to be hostile to the interests of this community going forward as we attempt to sort out where all this is going to go. I think you can look for some active cooperation on the part of Republican leaders in making sure that this agenda is carried forward. In that regard, I think one of the areas that Republican leaders will want to take particular leadership in is making sure that the ongoing operation of both public and private benefit programs is congenial to the continued development and adoption of new technologies. We have, as a party, strongly supported efforts to keep that kind of decision-making in individual markets rather than collectivizing decisions about coverage and reimbursement policy for these things. And I think as things go forward and as these choices that are associated with new technologies get ever more stark, that you will find the Republican leadership on the side of continued innovation and creating a framework in which new technologies can in fact be brought in. And I know, of course, that's a central concern of this community. In the longer term, I think the Republican leadership understands, or perhaps understood before everybody else is now to come to understand, that our existing level of financial commitments, with or without the exacerbation of the Affordable Care Act, put us in a posture that is probably unsustainable. Having said that, I want you to understand that there are degrees of sustainability and unsustainability that are important to parse here. Medicare and Medicaid, since their enactment in 1965, have grown at an annual rate of 3% faster than the economy for 60-odd years. If we continue that in the future, your children will aspire to be the chairman of the subcommittee of thrombolytics, the House Committee on Cardiology, because all of this stuff will have taken over the government by that point. And so you really need to understand that there's a big difference between 3% real growth, 2% real growth, and 1% real growth. And I think if we could get to 1% real growth, I think the vast majority of leaders in my party think that's sustainable. But 3% is just nuts. And so when you hear debate about some of the ideas being put forward by people like Budget Committee Chairman Ryan in the House, the specific choices that he has made in his legislation might not draw the support of every Republican, but the central idea that we have to rethink the funding path going forward in the future and rejigger the financing mechanism to get to 1% down from 3% is going to be a critical part of the future agenda. So all factors considered, I think you will find the Republican leadership in the United States willing to engage in a serious way in actually coming out of wherever we find ourselves to be at this point to some place that does feature substantial reforms in our insurance system, which everybody understands is untenable in both directions. But that you'll find that in order to work things through, that the concerns of this community will be listened to by leaders of both parties, and that I think we have a fighting chance of getting through all of this in the next 3 or 4 years with everyone coming out at the end of the tunnel and believing that net of everything that's gone on before and net of everything that will go on over the course of the next 3 or 4 years, that collectively in a bipartisan way we'll feel good about what we've accomplished. Thank you very much.